To our final session, official session. We have another happy hour. I'll talk about that at the end, and we want to start that now. However, because I know it's been a day where you have engaged mentally so deeply, I want us to do a very quick activity to warm us up. If everybody can please stand up, including my esteemed panelists here with me. And no, I'm not going to ask you to fill the seats in front. That's for tomorrow morning. Everybody please stand up. Please stand up. Am I visible? Yes, I am, in case you cannot see what I'm about to do. We are going to do a little activity. Do you all remember the 5 or factorial counting in mathematics? So like 5 factorial is 5 times 4 times 3 times 2 times 1. We are going to count down in a very similar way, but we'll do it from 10, and we'll use all our 4 limbs. How is this going to work? Right arm in the air, right hand in the air. All right, that's going to be 1. Left is the other. Right foot, I want you to kick it a little bit. And left foot, kick it a little bit as well. All right? And how is this going to work? We're going to go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7 with the right foot. 10, 9, 8, 7 with the left. And then 9, 8, 7, 6, 5, 4, 3, 2, 1. And then 9, 8, 7, 6, 5, 4, 3, 2, 1. 9, 9. And then 8, 8, 8, 8, 8, 7, 7, 7, 7. If I can ask, how long do you think this is going to take us? I had 5 minutes. Oh, what's that? 10 minutes, 10 minutes, going once, going once, going... some less than 5 minutes. All right. What if I told you that we will be able to do this in less than 1 minute? How many of you think I'm a liar by saying that? Hands in the air. Reveal yourselves now. Okay. Even you could, what? Okay. Arnold, if you can help me with a timer on screen. We're going to have a countdown timer. Okay. I'll ask that, one, we get our right hand ready. Remember, it's right hand, and right foot, left foot. I'll ask you count down with me, and I'll ask you at some point to really increase the pace as well. All right. Okay. Are you all ready? Right arm in the air. In 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 9, 8, 7, 6, 5, 4, 3, 2, 1. Louder. 9, 8, 7, 6, 5, 4, 3, 2, 1. 9, 8, 7, 6, 5, 4, 3, 2, 1. 9, 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. Louder. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. Faster. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. Louder. 23 seconds. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 50 seconds. 4, 3, 2, 1. 4, 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 1, 1, 1, 1. Give yourself a round of applause. At least for today, I am not a liar. And let this be a lesson to all of us that you can achieve anything in life, even when it seems impossible. Fantastic. I want us to channel, thank you. Thank you very much. I want us to channel that same energy into the conversation we are about to have right now, which is going to be a discussion. Sorry, I need to catch my breath. I've been shouting for a minute. Which is going to be a discussion on digitally empowered healthcare workers for today and the future, brought to us, of course, by Johnson & Johnson. To kick us off and lead the discussion, we have Dr. Sarah Milan, who is the Director of Health Tech and Innovation at J&J Foundation. As Director, she leverages her experience in behavioral science, data science, and technology to drive innovation in global health. She has a PhD in sports technology and a postdoctoral training as well at Arizona University. And Sarah has led cross-sector research initiatives funded by NIH, including digital behavior change programs and community-based interventions. At J&J, she enables diverse digital portfolio across both grants and impact investments dedicated to unlocking the benefits of technology and innovation for those who need it the most. Ladies and gentlemen, with the loudest round of applause we have had for the entire day, please put your hands together. Welcome the entire panel and Dr. Sarah as well to kick us off. Over to you, Dr. Ari.
Thank you so much, and thank you for giving me a few extra minutes for my heart rate to go down. I think I'm still out of breath. Welcome, karibu, bienvenue. I'm out. Welcome. Again, thank you for making it through the first day, and what a day. Really excited to be kicking off this session with these wonderful people here. And just to get started, I'm really going to just start with a question. And that is, do you feel enabled or do you feel empowered by your mobile device? If you have a mobile device, you're enabled. You have access to the tool. But empowerment is different. It's not just about access, it's really about agency. That's the confidence, the capability, but most of all, it's about control. So delighted to be here on behalf of Johnson & Johnson Foundation, where we really truly believe in investing in our essential healthcare workers and the tools that they need to care for the communities. And we see that really as being the true key to unlocking access to quality care for patients that deserve it most. I'm really excited to be co-hosting with Living Goods as well as having many panelists who really have great, deep experience in digital empowerment, the good, the bad, and the ugly. And I think something that also resonated with us all, and we felt really strongly about, is that this conversation was so much bigger than the voices on this stage, even those in this room, even those online, welcome. It's really about so much more than that, those out in the field. And so we felt strongly about amplifying other voices on this stage too. So the format is slightly different. We're going to start with doing some lovely introductions to the panel. We agreed that we would keep them short, so sorry my bio was so long there. We're going to keep it short, but we'll talk to you afterwards. And then we're going to get into some rapid-fire questions that have been informed from a survey that went out, so insights from some of you in this room and out in the field. Then we'll have a bit of a discussion about those insights, and then we're going to close with a video, so a 5-minute video that's been put together by the Living Goods team. And that's really, again, for those out in the field and doing some of the hard work. So first of all, we'll kick off with the panel. Welcome. I'm going to start with Maeve Agoro. We're so delighted to have you here. Community health specialist with over a decade of incredibly important experience out in the field. And I believe you've onboarded more than 50 community health promoters onto Aegis. So not only is she doing an incredibly hard day job, she's also digitally empowering peers and colleagues. So really delighted to have you on the stage, Maeve. Next, we have, if you want to do a little wave, we have Dr. Joyce Wamishwe, who has already been on this stage this morning, so we're grateful to have you again. Not just an MD, but also the digital health and technical lead at the Digital Health Agency. More than 2 decades, really, of experience, and again, we're just so lucky to have your viewpoint on this stage. And next, a little wave from Anne Ithabu, Country Engagement Manager at Africa Frontline First, and I believe you've been seconded, correct, by the Alliance for Financing Health? Yes? And again, great experience with working with the MOH across 17 countries. Amazing. So yes, again, very lucky to have you on the stage. And next, a little wave from Jemima Kabira. So co-founder of Afia Reach Limited, which is a social impact tech organization really committed to transforming healthcare delivery in Kenya, digital health services, and in particular, mental health services. So again, a really good viewpoint to have on this stage. Last but not least, we have Kanishk Katara. Pleased to say that we have so many females on the stage, and Kanishk has been such an advocate for that, so thank you. He's been a great co-designer of this session and is really leading the digital and innovation portfolio at Living Goods. And again, more than 2 decades of experience across 23 countries. So a huge round of applause for an incredible panel, and thank you for joining. So we are going to start with some warm-up questions for the panel. It's nothing too serious. What this mainly was about was getting voices not on this stage to be heard. And quite honestly, I think we were all surprised by the response. It was a survey that was launched by Living Goods for 10 days. Well, within 10 days, we'd received over 1,100 responses, which was quite surprising. 80% of those responses were from healthcare workers. So I think it just reinforces the desire to be amplified and heard. So we're excited to share some of that today. And with the first question, maybe just place your hand in the air, and you can join in too in the audience if you want to vote for a certain answer. We asked respondents, how would you describe your digital health experience? How many do you think describe their experience as transformational? Do you think it's 1 in 2, 1 in 3, or 1 in 4? So raise your hand if you think it's 1 in 2. All right, well, we've got 2. 1 in 3. We've got some supporters in the audience now. And then 1 in 4. Interesting. That's what I thought. It was actually 1 in 2. I know. So we're very keen to dig into those insights some more. I think that's just a taste of what's to come. I think we were also surprised that another 30% of the respondents described their experience as positive. So again, we were quite surprised by that. But that positive experience, we wanted to know, well, what were they finding helpful? So again, I'll just read out some answers for you to choose from. What aspects of digital tools did respondents say were working well for them as community health workers and supervisors? Is it easier data collection and reporting, communication with their supervisor, workload and time saving, or patient follow-up and tracking? You could take 2 of those, kind of top 2 answers. So raise your hand if you think it's easier data collection and reporting. Okay. Communication with your supervisor. Less so. Time savings and workload. Okay, quite strong response. And then patient follow-up and tracking. Quite evenly split. And again, these are opinions, and that's okay. It's what has worked for you. In our particular survey, we saw that data collection and reporting was the top choice, at 93% being chosen in the top 2, followed by patient tracking and follow-up. But we'll share more on that. How are we doing on time? I think we've got time for a few more warm-up questions. We know it's not all rosy. So on the flip side, we also asked, what are the top 2 reasons why you think digital health in community health is failing? And I'll give you a few options to choose from. We have lack of incentives. Is it insufficient funding of maintenance of devices? Digital literacy? Usability? Or community trust? So again, maybe 2 of those options, and it's your opinion also. So maybe raise your hand if you think lack of incentives. Yeah. How about insufficient funding? I figured that would get a few hands in the air. Digital literacy? Okay. Usability. And then community trust. Okay. And again, opinions. So we found that the top two main barriers, and they were very close at 66% and 64%. The first being insufficient funding for the maintenance. So not the setup, the maintenance of those devices once they're out in the field, followed very closely by lack of incentives. It's not just about access, it's motivation too. So I guess not too surprising that came through. And third was digital literacy, in case you're interested. Yeah. Got a few more minutes, just 2 more questions, and then hopefully everybody feels a bit warmed up. We also asked about sustainability and some of the best approaches to sustaining community health, digital health programs. What do you think were ranked as some of the top approaches for sustainability? We have public-private partnerships, open source platforms, government budget allocation, integration into GDHF, capacity building locally, or donor coordination. So quite a few options there, and again, it's your opinion. So if you feel strongly, put your hand in the air. Public-private partnerships. Okay. Open source platforms. Anyone? Government budget allocation. Oh, winner, winner, winner. Okay. Integration into GDHF. A few folks. Okay, thinking about it. Local capacity building. Okay, and then donor coordination. Less so. But you're fighting for it. Clear. For the survey, again, just opinions, number 1 was government budget allocation at 80% of the time being in the top 3, followed by integration into national systems and local capacity building. And then the last one, before we hit the 30-minute mark, we did also ask the 80% of the healthcare workers who indicated that they felt familiar with emerging technologies such as AI. But what do you think was listed as the top priority for the future of digital health? We had a few different options here. Was it scale and coverage, financial sustainability, leveraging this emerging tech responsibly, or was it government coordination, strengthening government coordination? So I'll get this last raise of hands for scale and coverage. One there. Financial sustainability. Leveraging emerging tech responsibly. Governance and coordination. What about user-centered design? Got a few nods. It was a bit of a trick question, really, because I just gave the answer away. We were quite surprised that the top answer from the survey was strengthening user-centered design specifically for community health workers, which speaks to the empowerment piece. And so that came before financial stability, sustainability and stability, and before governance and coordination. And bearing in mind that a majority of the voices in that survey were healthcare workers, so I think a real call to action there that will probably carry through now into our discussion on this stage. So we're just going to take the time now to kind of dig into some of those insights. And Maeve, I'd love to start with you as really having this experience in the field. And so if we heard that community health workers are advocating for user-centered design, how much do you think local voices are embedded into the design of digital tools currently?
Thank you for your question. Local voices, and more specifically CHPs, they're drivers in the healthcare system. They're the ones who make the healthcare system move. Why would I say this? Because they are at level 1. They're the ones who interact with households. They are the ones who are able to monitor these households, visit them, do referrals to their facilities. They're the ones who are able to be the drivers to change when it comes to our healthcare system. And it's very important to note that we have improved health outcomes, and these health outcomes are improved because we have deliverables that the CHPs are using the digital platform to do their reporting and to do the monitoring. So we are able to see and visualize the work that they're doing. So for instance, a CHP visits a household and gets a pregnant mother. He or she is in a position to, offer the health education, register the mother in the digital platform, do a referral if there's need, make sure she does follow-up for this mother, up to the point where the mother has a safe delivery in the facility. CHBs are doing a lot of work that can now be visualized from the level 1 to the upper level, the national level. A person is able to, just click in and see what a CHP is doing. And to also support this work, as a community health assistant, I have the role to supervise and see that the CHP is doing the right work and doing it on time. Digital platform also enabled us save on time. We have data that is already generated. So we don't, when I look back initially before we embraced the digital system, we were spending so much time losing data, and that was not efficient. So right now we have a robust way in which we are doing our work, and it's more visualized. We also ensure, using our universal health coverage, it ensures and has an objective where we have access to quality healthcare, and we are gearing towards ensuring that our households are able to access care without financial hardships. We also we're aiming during using the CHS to empower people to live through transformative and responsive health-seeking behavior. So the CHPs are able to reach the households on time, and they're able to seek healthcare services on time. So yes, local voices are in the healthcare system, and they are not just partially, they are fully involved in health outcomes that we are all involved in. And I'm happy to be here, and I'm happy that we have partnerships, and our government, Kenyan government, is really supportive. Right now we have more than 100,000 CHPs who are digitally enabled, and we have government support and goodwill, and we're looking forward to a future that is more robust, more organized digitally. Yes, we have challenges, but I think that is part of growth, and we are looking forward to making better improvements using research and technology that is there. Thank you.
Thank you, Maeve. And it sounds like you're so embedded in using these tools, particularly on the visualization side as well, which is a good kind of segue actually to Jemima as a tech provider, where you have all the experience of doing something with those data. Curious, even with your background as a nurse, how are you embedding local voices at your reach and your ways of working?
Thank you very much, Sarah, for the question. First of all, I think maybe just to start at national level, how we are embedding voices even at national level is making sure that even at implementation phase, you're not working in a silo, you're getting a lot of input right from national. When you go to the counties, you get input from the county health management teams, and you scale it down all the way to the community health provider. And one of some of the lessons that we are getting from the work in terms of connecting community systems with healthcare, the facility EMRs, is healthcare workers are saying, how can data be summarized in a way that it's easy for them to make decisions? How can they be able to track referrals in a way that's not very difficult? And then one thing is that the developers need to be able to be responsive. So as much as sometimes the systems may be developed in a way that may take time, they that iterative process is something we are trying to strengthen, and we are actually doing that. Even with the work the CHPs are doing through the electronic community health information system, how we can be able to listen into their asks even as they enhance the data they are collecting for decision making, listening to them and being able to cascade that information back to the national teams and the developers working through the system so that their inputs are incorporated in the iterative process of development. So that's been some of the experience, and it's very exciting to see the voices from the front line being seen on the tech side of it. Thank you.
Thank you. And it sounds, as you mentioned, it sounds quite iterative. An iteration means time and resource, which I think speaks to some of the insights that came up in the survey where we heard about the top barriers. And so we'd like to kind of shift maybe to Joyce and Anne as we think about the barriers that were mentioned. So government budget allocation being good for sustainability, and also insufficient funding for the maintenance of devices and perhaps the visualizations that go along with them as being a top barrier. So maybe Joyce, if I can speak to you first and just maybe share with us, as part of the Digital Health Agency, where digital innovations fit within the larger government sphere for transformation.
Okay, thank you. That's a common question that is asked to DHA. What's the space for innovation? And I just want to say that innovation is at the core, has to be at the core. But many people also think innovation is earth-shattering, breaking things, and bringing something big. But innovation is the everyday improvements from voices that you don't even expect. And the one thing at DHA I keep on telling my technical team is we have to learn to listen more and talk less, because it's only then that you pick up what the user really, really wants. So we are deliberate about innovation, right from even how we've put it in our strategic plan. Even our HR instruments appreciate that you cannot do digital health transformation without giving that space for innovation. So we have a whole directorate that is to deal, under it there is a division for identifying these innovative things, but it doesn't have to wait for the division level. It is something that we are consistently, intentionally doing every time. But for the big innovations that people like talking about, the earth-shattering, skyrocketing kind of innovations, so we want to have this space where innovators can come and present what they are doing, and then we can be able to identify what can go to scale. It is something that we are borrowing from, innovative labs like the ones Path has had. I know in the past also we've had spaces like, if you were there earlier in the day, I talked about a digital health technical working group. And that is where innovators come and showcase what they have, and then we try and see where we can fix it for maximum benefit. The one thing with innovation is, at the end of the day, it has to benefit the intended audience. And even if at that particular time it's not good enough, or rather people, we say this one might not go to scale, the feedback we give improves that particular piece of innovation. I've seen it happening in the past. And it's the same thing that we want to do going forward. We really appreciate and recognize there's a lot of talent in this country. Young people are always reaching out to me and telling me, Joyce, we have this, we have this. I've been in spaces where, let me go back to the Path Innovative Labs, where you go, there is a whole day of showcasing various innovations at different levels of the health system. So those are we definitely believe in innovation, local talent, and improving, progressing as we move upwards. That's our objective. Upwards and as we progress, yeah. Thank you. Yeah.
Thank you, Joyce. And just that locally owned innovation and the idea that it doesn't have to be the skyrocket, like day to day, incremental, is something really powerful about that. And so then kind of continuing that sustainability of the funding that maybe needs to go around that. Anne, would love to hand over to you and the role that Africa Frontline First is playing as we think about digital health information systems.
Thank you so much, Sarah. And I'm honored to be part of this panel. My name is Annie Thibu, working for Africa Frontline First, which is an initiative that is supporting governments across 17 countries currently to build strong, professionalized, and digitally enabled and empowered community health systems. Our focus goes beyond rolling out of these digital tools, but we mainly focus on strengthening governance, financing, health system foundations to ensure that community health workers are trained, equipped, supervised, and also compensated for the work that they do. We have seen several challenges across the countries that we are working in, and the survey results actually mirror the challenges that we are seeing across the different countries. I'll name just a few, specifically the fragmented digital solutions which are rolled out across these different countries. We are also seeing limited interoperability between the community health information systems with the national information systems such as the DHIS2. We are also seeing insufficient long-term financing for community health in general, but also for digital health, and also capacity gaps. So looking at skills, when you look at the health workforce, but also in terms of the infrastructure. And this poses serious barriers for the deployment of the digital health across the countries. Despite these challenges, we are also seeing real opportunity. We are seeing growing momentum to shift from the isolated pilots that have been happening, and also the fragmented solutions that have been in place. And there is a shift to now more coherent government-led digital ecosystems that can be scaled sustainably. At Africa Frontline First, we are supporting governments across what I can say 3 S's. System, so first of all strategy, then system, then sustainability. So under strategy, a lot of our work goes into supporting governments, particularly when you look at the Community Health Directorate and other related departments within the ministries of health and within government, helping them or supporting them to define a vision that is then articulated within the community health strategies and other strategic frameworks that exist within the country. Also, still within strategy, supporting governments to put in place or to strengthen coordination structures to ensure that all the stakeholders within the countries are actually aligning with this vision. So that's on the strategy. Then we are also supporting on the system component, and here it's really strengthening the operational backbone. So what is needed to actually deploy digital health within the countries. So this includes, the design of, these digital tools that community health workers and their supervisors are using. Also the piloting of these tools so that, we ensure that they are fit for the context in which they are being deployed. And then also just looking at aspects of interoperability. So, for instance, one of the countries that we are supporting is Mali, where we have, supported them to address gaps that were existing between the community health information system, which is called DISC Mali, and the DHIS2. Then the third area of work is around sustainability. So really ensuring that, the models that are being deployed endure, beyond, all these challenges that we are seeing related to financing. So ensuring that, they are sustainable. And how we are doing this, I think there are a lot of interventions towards sustainability. But, some of the things that we are doing is actually supporting governments to estimate the needs when you think about digital health and community health in general. What are the needs, 3 years from today, 5 years from today? And at the, beyond the, estimation of the needs, also being able to, to track the existing investments, because there are investments that are coming in, whether these are external resources and whether they are coming from, government coffers or from public-private partnerships. So being able to track these investments and ensure the effective and efficient use of those resources. The last point that I want to highlight under sustainability is also just looking at the long term, supporting governments to define pathways to finance community health and digital health as well in the long term. So looking at what are the potential ways that that governments can sustain these digital health efforts, whether it's through the integration in the national budgets, whether it's, doubling down on the public-private partnerships. So to conclude, what we are seeing across countries is that digital transformation succeeds when it is system-led, when it is government-owned, and when it is aligned to national priority. And Africa Frontline Fast is helping countries to build those foundations so that digital tools are not just launched, that they actually last and they are scaled, and ultimately they improve health for communities. Thank you.
Thank you, Anne. I love having something to remember like 3 S's, so thank you for that. So strategy, systems, sustainability. Love, excellent. I'm just going to build on some of the barriers actually that you mentioned, and one that came through the survey. Yes, people said transformational, but also in terms of concerns around emerging tech, the top barrier at a whopping 60% was data privacy and security. And so want to hand that to yourself, Kanishk, for your reflection on, are there ethical concerns, and how might you be navigating that with the work that you do at Living Goods?
Thank you. Thank you, Sarah. This is a PhD topic, right? You're asking me to respond in this panel.
Quickly.
I think, before we come to emerging tech and AI, I think the question also has to be around digital. If I have to, sum it up in, simple words, there are 3 key risks and ethical concerns which I see. Number 1 is the community health workers and, supervisors like me are supposed to be the community caregivers. Now, with the increased digitalization, are we converting them into data collectors and increasing the workload that they are not able to distinguish between their personal time and the work time? I thought I knew this subject till the time I attended a presentation yesterday in one of the sessions, and it's opened a completely new plethora of work. Number 2 is around data sensitivity and privacy. obviously, a big topic of discussion. There is household data, there is individual data which is getting collected, and government is, enacting laws, enacting policies to ensure the protection of that. The implementation of that is where, we need to be very careful about as to when it becomes, it moves from safeguarding information to becoming restrictive in terms of service delivery. So that is definitely a concern on both accounts. And number 3 is what you asked about, emerging tech and AI. Again, I feel that AI and emerging tech has a lot of potential to push forward the transformation. The question is it ready today? The underlying algorithms, are they ready? Are they partial or impartial enough for us to rely on them when it comes to healthcare service delivery? It was not a long time back when you could ask any AI model to draw the picture of a person, using the left hand, and the AI models could not do it. Can they draw it in 6 months' time, 2 years' time, a year's time? Definitely yes. So the question for us is it going to increase inequity? Is it going to increase the bias in the systems if the models are not ready? And that's what we need to be careful about when it comes to adoption. At Living Goods, we believe boldly in innovation, but innovation which is based in equity, which is based in inclusivity, which is based in parity, and of course, the honesty of the system. So we focus on, when it comes to, what I talked about, the overload of work. Through digitalization, we focus on user-centric design. We focus on ensuring that the tools which we are developing or are being developed for the community health workers are job aids, not job ads for them. When it comes to data privacy, obviously our work is focused on consent. Are we taking the right level of consent for the right level of service delivery? Are we ensuring that the right level of training is available for the service providers who are accessing data? They understand the responsibility of carrying that data and how are they using the data. I can talk all day around tech interventions, passwords and everything, but it boils down to the human in the loop. And that is my third point on AI. Human in the loop is our philosophy when it comes to adoption of emerging tech and AI. And we need to be very conscious of that. There will be a time when a lot of things will be automated, but till the time we develop the trust, we focus on bringing the human in the loop from a decision-making standpoint and ensuring that the ethics are, taken care of. We obviously are working with so many other partners, in collaboration to understand okay, here's the thing. I think the ethical norms also evolve with time, as technology evolves. So how do we keep pace with that is something which is our focus. But is it the final thing? I don't think so. There's more to come.
Thank you. I know, as you said, PhD level topic, and we're still all navigating it and figuring it out. I do want to take that moment then to say that this panel have been so thoughtful about curating and speaking to you in a way that gives you a snippet of the bigger picture. So I really want to encourage you to follow up on some of these topics with those on the stage, because there is so much underneath this. So really do encourage that after this session. But I do want to do a quick round of if you were to give kind of one call to action or a piece of advice for anybody in this room, online, or what we can share out in the field. And maybe I'll start on the far side with Jemima, if you want to go first, and then we'll just come all the way along the panel.
Sure, thank you. I think for me, the rallying call is there's a lot of technology that's being implemented, but I think we need to be very guided in terms of what are the national priorities so that we can pull funding and support national priorities for faster implementation, for faster scaling, and for technology to be used for what it's intended to do and not to make the work for the healthcare workforce much more than already what they have, but as an enabler of the work they're doing. So pulling funding together, being able to leverage strategies and guidelines that have been rolled out by government, working in line with that so that we are not siloed, because we've learned from the work we've done that working together as a collaborative actually makes the work easier. There's no duplication of efforts. You reduce piloting and reporting on pilots, and you implement for the benefit of everybody. So the call is really let us to be able to sustain the gains collaboration can really not be overlooked. And for me, that is the future going forward, so that we can be able to use technology for what's intended within the sector of healthcare. Thank you.
Thanks, Jemima. Maeve, over to you.
I'm optimistic that we are heading into a future where we have a digitally empowered healthcare workforce at level 1, that is the community. And to do this, we need to have an increased and efficient and accurate and user-friendly workflows for the CHBs on the ground. We also need to have continuous support on mentorship, coaching, and capacity building, on digital literacy, and being able to handle tech issues as a community health supervisor and as a chair, so that when the CHB has technical issues, I'm able to handle that. And we also need to continue with the partnerships through the health financing. I know our government is doing a lot, but we still need a partnership, because the digital space, it's big, so it can accommodate all of us. We also need to have access to infrastructure and ensure that the CHPs have funds, and the funds need to be affordable. The government also needs to look at our financing model, where a CHP, probably if he or she loses a phone or the phone is faulty, we see a workable way of replacing this phone, so that the cost and the burden is not entirely on them. We also need to have incentives. A motivated CHB works better. They need to have incentive, they need to be appreciated, their stipends need to be on time. And we've had conversations with them. I'm a supervisor. They feel that what they're getting is little, and they would not really mind more added to whatever they're getting right now. So that also needs to be looked into. We also need to strengthen the policies that are there. If you look at me as a supervisor, the policy states that it's 1 chair to 10 CHPs, but when you come on the ground, it's different. So the policies need to be looked into and expand the community health services space, and have more chairs onboarded. We also have to have strong social and accountability mechanisms at the community level. We need to have community health committees that are robust. And then our health facilities also need to have the health facility management committees that are vibrant and are able to work hand in hand with the committees at the community level. With all this in place, I think we have a future that is digitally bright. Thank you.
Maeve, I think you covered so much there. And I'm just wondering from the panel, what a way to kind of finish with a call to action from community health workers and community health worker supervisor, and just conscious of time. So we're going to finish with the video, but please do follow up with everybody else on the panel for some of their call to actions, and plenty of time at the happy hour. But we do want to leave you with some voices in the field, and just want you to remember, not just to give tools, but to really give that agency to those using it. All right.
The Ministry of Health is developing and rolling out digital health tools with the premise of providing digital job aids to different health workers in the different theaters of actions in which we work. That could be the community, that could be in health facilities, that could be at border points of entry where we do some health screening, and in other places where maybe we could be involved in some surveillance efforts.
We had a workforce of village health team of 1,450 people who were ready and we are working with us. And so far we have given out the phones with the apps to assist in the digital transformation to the 1,450 VHTs.
Kenya is very lucky because the current government has community health or primary health strengthening as the vision. Kisumu was extremely lucky because the governor's first manifesto talking about strengthening of primary health from the beginning, and that is where it started from. So it is the leadership that drives all these other things that we are talking about.
When we used to do the paperwork, sometimes maybe the papers, they have disappeared, you don't know where you placed them. But this one is documented. The information is safe. What I have is safe. I can keep track of what I did in the past.
GDHF has really helped us by doing our everyday supervision, because back end in our tablets we are able to see which CHV has gone to the field today and what the CHP has done, even when you cannot do the one-on-one supervision, you can supervise through the phone.
Libo wabanga oyagala ofunye oba omukyala w'olubuto ng'olina okugendanga buli kaseera okumanya ebimufaako, watambulanga n'ogendayo, naye kati osobola okukozesa essimu yo n'omukubirako. Ne bwe yabanga mwana ng'oba mulwadde, wagendangayo okumanya omwana ali atya, naye kati osobola okukubira ku muzadde n'obanga osobola okukozesa essimu yo.
It is helping us to do mentorships based on what is exactly happening in the reporting. Because with this system, you are able to know that so and so is not reporting. So we tailor our intervention to reach out to such a person instantly as a district. Meaning that even at facility level, we are not just looking at the data itself, but we are using this data to make decisions.
To ensure that the digital health tools are easy to use for the providers who are using the tools. And I'll take, for example, like ICHI's system that we're using in Kenya, which is easy to use by the CHPs, and they're able to give services at the household level.
So we looked at speed vis-a-vis interoperability, and the interoperability structures are now known worldwide. Like for health, we are talking about fire standard, HL7 standards. So build a system from the beginning that can be able to interoperate into the future.
With the current developments that we are doing, we are trying to put ease of use at the core, so that the curve towards onboarding is not a very challenging one.
To think about integration rather than fragmentation. And what I mean by that is that in Kenya, for example, we have the ECHIS, the Electronic Community Health Information System, used by all community health workers across the country, with the intention that that data should be aggregated at national level.
Focus on simplicity and value. Simplicity of the technology used and solution developed will make it easy to adopt and maintain.
Really focus on the 1 to 2 key things that will make the difference for the users and for your partners in general. It has to be cost efficient, obviously, because that's what will drive success and achieving scale. But if you don't start with the key value, it will be really difficult.
La durabilité de ces outils, comme le e-santé.com, je dirais que d'abord, il serait très important d'assurer un très bon suivi technique de ces outils pour éviter les pannes prolongées. Ensuite, d'améliorer les sources de charge des téléphones, car la majeure partie des pannes signalées sont liées au circuit de charge.
Thank you. I know we went a little bit over, so thank you for staying, but just a huge round of applause for the panelists, for all the work that was done with Living Goods. You were tremendous, and I really look forward to connecting with you after the session.
Can we give them another round of applause? What an incredible way to round off our plenary for day one. I'm going to invite all our panelists to come together for a group photo. Again, I'm going to ask our audience if you can help us identify who is not smiling, and then we can get the teeth out. Again, a huge thank you to the panel. Dr. Sarah Mullane, Dr. Joyce Omishe, Jemima Kibira, Anne Ithibu, Kanishka Katara, and of course, Maeve Agoro. Thank you very much. Ladies and gentlemen, are you still with me? Are you still with me? Fantastic. I can see some of you are already leaving to catch the panelists. If I can have your attention just for a minute and guide you on what is going to happen next. This is not the end of day one, but it's almost the end of day one. So give yourselves a round of applause for making it to this point. Thank you very much. As I said, we are not yet done. In about 45 minutes, 40 minutes or so, we are going to move into our Appy Hour, which features both digital apps and happy hour. So we do have drinks, alcoholic and non-alcoholic, available for all of you right outside that you can start taking now. I'm going to ask us all in a moment to kindly leave the room so they can set up the space. But not yet. So they can set up the space for the happy hour to begin, which will begin at about 6 p.m. in this hall. And it's brought to us by Dima, Gi, and Living Goods. So we want